Hello guys and welcome back to my YouTube channel. Please, if you have not subscribed, just hit the subscription button and support me. So today you have a very interesting topic about dietary management in febrile conditions that mainly consists of fevers. So generally, fevers are the elevation of the body temperature above the normal ranges, and this may caused by the inflammations or the infections in your body. And so the fevers may vary due to the duration that they occur in. We have the short fevers, that mainly comes by maybe you have a flu, you have a cold, or maybe you have tonsils. And we have the chronic fevers that mainly comes with malaria and typhoid, and also tuberculosis. And so when you have fevers, your body metabolism tends to change, so you will always have an increased metabolic rate for every degree Celsius that your body acquires that is above the normal range, and your body becomes so restless, and this causes an increased caloric needs in your body. And when you have fevers, also you have a decreased glycogen and adipose tissue stores. That's why you need more caloric needs or caloric diet. And there is also an increased catabolism of proteins, especially in typhoid fevers or malaria. And also you will have increased loss of urea and additional pressure on your kidneys because they are overworking. And also your body will have an accelerated loss of body fluid due to sweating, and also the excretion of the body waste. And you will also have an increased excretion of sodium and potassium. So when a dietitian is recommending a diet for those people who have fevers, they always consider many things. So they first consider the dietary severity of the pathological condition and upon the length of convalescence. And so they will always give the diet needs or the dietary needs according to how the disease have progressed. And also they will also consider the amount of energy you are supposed to take, the amount of protein, the amount of fat, the amount of carbohydrates too. yeah and also minerals. So for energy, you are always required to increase your caloric requirement by 50% in a day when you have high temperatures due to the tissue destruction in your body. And because of the increased restlessness, also you will have an increased caloric requirements. So initially, when a patient is in a very stable condition, they always tend to take 600 to 1,200 kilocalories in a day. So when a patient gets fever, that amount of kilocalories is just increased rapidly. In order to cover lost energy, and also in order to prevent the tissues from being destroyed. And so for proteins, it is always 100 grams of proteins is added in the normal amount of food or amount of proteins eaten in a day. And high protein beverages can be used to supplement the regular meals in your diet in order to have the required amount of proteins when you are in that unstable condition or that fever, or when you have that fever. And so the glycogen stores are always replenished when you are always having the right diet. And for carbohydrates, you just take the carbohydrates as required. And you also, when you have fevers, the carbohydrates that are being taken in your body are always converted to glucose that is always absorbed in your bloodstream and in the most preferred way possible. And so fat intake should also be increased in order to increase by using fried foods. And for minerals, you just take the sodium, you just make sure that you have a sufficient intake of sodium chloride, mainly from the salty broths and soup, and just sprinkling salt on your food. When you have fevers, you can just sprinkle a small amount of salt in your food. And for fruit, you also take fruit juices and milk, which are relatively good sources of these elements too. Yeah. when you have fevers, it is always your body always requires you to get a lot of vitamin A and ascorbic acid and B vitamins, which are essential in the diet, as they also help to increase the calories in your body. And for fluids, when you have fevers, always make sure that you take the enough fluids in order to compensate all that is lost through sweating and perspiration, and in the excretion of the body waste, and also in the urine while excreting the waste, in order to keep your body hydrated. So a daily intake of maybe 2,500 to 5,000 milliliters per day is always necessary. While talking about fluids, we don't just talk about water. Fluids means you can have beverages, you can have fruits, you can have juices, and you can have that water and also beverages. So it is essential in your body in order to keep yourself hydrated and to prevent other complications that are being brought by loss of more fluid in your body. When you have fevers, you always have cases of indigestion that you should compensate that with blended and ready to digest food, and in order to ensure rapid absorption of nutrients in your body. And also the food should be soft and of regular consistency. And also you should consider the intervals of feeding. Just feed small quantities of food, it may be 2 to 3 hours, and nutrient absorption without overtaking the digestive system. So we shall go straight to discussing diet in fevers or in short duration fevers, where most of all the fevers are shortened by antibiotics. Antibiotics really helps, but you should not buy over-the-counter drugs. Always go and see your doctor. And so diet therapy and nutritional can be met without much difficulties. Yeah, they are readily available. And during acute fever, the patients always have a very small appetite, and they feed poorly. Liquid food should be offered at a frequent intervals in order to ensure that they have the required amount of proteins in their body, and also to ensure that they do not suffer due to the damage of their body cells. Also, sufficient intake of liquid and salt is always essential. If your fevers persist for more than a day, it is always recommended that you take a high protein and high calorie diet in order to help in healing process. So for fevers to occur, there must be some triggers, and those include infections that include flu and pneumonia. There may be some inflammatory diseases that include maybe rheumatoid and the Crohn's disease, yeah, and some medications that includes antibiotics. Also, in infants, teething is a major cause in leading to infant fevers, and also in some immunizations also causes like the tetanus jabs or diphtheria. And when you stay more hours just out there outside the sun, you may have an extreme sunburn that can trigger fevers, and also food poisoning can also trigger high fevers in your body. And depending on the cause of the fever, additional symptoms when you know you have fevers may include loss of appetite, you develop dehydration, you have a body general or weakness where your body becomes so lethargic, and muscle aches, you have headache, you just shiver and you start sweating. Yeah, those are signs that you might have fever. When you can't access the health facility, the first aid of fevers, or you can give first aid at home for fevers. You can just have the person drink plenty of fluids. You can have the person take regular bath using lukewarm water, not cold and not very hot. And you can also make sure that the room temperature where the person is resting is very very comfortable. And also you can have the person taking Advil, or most people know them as Brufen, or the acetaminophen. Yeah, they can take those antibiotics. They will really help to lower your body fevers. and you should always consider some things for your children. If your child have a body temperature that exceeds at 9 degrees Celsius, take him or her to the hospital. And if your child have had those fevers within the last days, if your child is restless and irritable, if your child cannot make an eye contact with you, and if your child has recently had one or more immunizations, and maybe if he has a serious medical illness or a compromised immune system, you should always take that child to the hospital. Don't buy the over-the-counter drugs for your babies, please. And also, you should call your doctor if you have a body temperature that exceeds maybe that 9.4 degrees Celsius. Also, fever may show danger signs. Maybe when you have a very severe headache, maybe when your fever is always accompanied by throat swelling, maybe you have a stiff neck or neck pain, maybe you feel pain when urinating, you have muscle weakness, maybe you start developing mental confusion or mental issues, maybe you just have a breathing problem or chest pain when you are trying to take in and out your breath, and you have a persistent vomiting, and you just become sensitive to a bright light, and you develop skin rashes, and that even gets more worse. That should be danger signs that you should always go to your doctor immediately in order to prevent more other complications that might follow after that. In order to prevent fevers in high cases, you just wash your hands oftenly, especially before eating, after using your toilet, and after being around a large number of people. And you avoid sharing cups, glasses, and eating utensils with other people that you are not used to. And cover your mouth when you cough, or your nose when you are sneezing. Yeah, nowadays we cover our mouth almost like this due to COVID, yeah, which is also good. And you should always avoid touching your nose, your eyes, your mouth. Those are very vital organs that can lead to infections. It also makes it easier for viruses and bacteria to enter your body and cause infection. So it is not advisable to always touch your face. Yeah, and you should always or show your children or your siblings how to wash their hands properly. So guys, that marks the end of our session today. And please remember to subscribe, remember to comment, remember to share. And God bless you so much for your time. Yeah, thank you.